Good day, ma'am. I am Leopold Muhammad, a nursing student from Davao Doctors College. And for today's tutor demonstration, I am going to perform the Leopold's maneuvers. Leopold's maneuvers is a systematic palpation of the abdomen for assessing a fetal presentation and position. This is to determine the position of the baby in utero, to determine the expected presentation during the labor and delivery, to identify the fetal heart tone, presentation, position, and the attitude of the fetus. The materials needed for this are stethoscope and the pillow. And now, I have done explaining what this maneuver is and the materials needed for this procedure. Let's start the procedure, but before that, we must wash our hands to deter the spread of microorganisms. Next, after washing our hands, explain the procedure to our patient as well as introduce yourself to build rapport and gain the patient cooperation. So, hello ma'am, I am Leopold K, your student nurse for today. So I'm going to do the Leopold's maneuvers, which means I am going to touch your abdomen or expose it, figure out the position of your baby. Let's assure that only your abdomen will be exposed. In this procedure, it will not inflict harm to your baby or to you, ma'am. Is that okay? Okay, ma'am. Thank you po. Then, provide the patient's privacy by closing all the doors and also the windows. This is to ensure the patient's comfort and confidentiality. Now that I've closed the door as well as the window, now let's the patient empty her bladder before the procedure to promote comfort and allow us to have productive palpation because the standard bladder will deviate the patient's uterus. So ma'am, do you want to use the restroom so that there will be no interruption throughout the procedure? Okay ma'am, thank you po. Next, position the patient on supine with one pillow under her head and with knees slightly flexed. This is to providing comfort, also flex knees. So ma'am, I have pillow behind your back. So could you please lay down and slightly flex your knees, and after that I am going to expose your abdomen. Ma'am, is it okay? Okay, thank you po ma'am. So I am going to assist you ma'am, ha? 1, 2, 3. So, please slightly flex, ma'am. I'm going to expose your abdomen, ha? Thank you po. Next, if right-handed, stand at the woman's right, facing the patient. So the first maneuver is called the fundal grip. In this maneuver, this is to determine which part of the fetus in the fundus. Next, face the patient and palpates the uterine fundus to determine what part of the fetus lies in the upper part of the uterus. So, ma'am, I will now start the procedure po, ha? So, I am going to palpate the mother's abdomen just below her chest in a triangle form using a gentle but firm motion. But before that, I am going to warm my hands and palms on each side of the upper abdomen and palpate around the fundus. So, ma'am, I am going to touch your abdomen na, ha? So, the next maneuver is the umbilical grip. This is to apply deep pressure with the palm of the hands while using the other hand to fill your uterus. Palpates in a downward direction on the sides of the abdomen, applying gently but deep pressure to determine the position of the fetal extremities, the fetal back and the anterior shoulder. Palpate with one hand steady on one side as to support while the other hand exploring on the other side. maneuver called pelvic grip. This is determine whether the fetal head in a cephalic presentation has descended into the mother's pelvis and engaged in the cervix. Places one hand over the symphysis pubis in an L shape, just like this, and grabs the lower uterine segment between the thumb and the fingers to feel the presenting part. If head is in the pelvis, which means it is engaged, and if not, presenting part is still movable and it is not engaged. The fourth maneuver is the pelvic grip. At this part, we will turn in the faces the woman's feet to confirm the findings of the third maneuver and determine the flexion of the vertex. Move your finger, both of your hands, gently downside of the abdomen toward the two pubis. Then, palpate the cephalic longness of the vertex prominence in the same side as this small part suggests that the head is flexed optimum. If the head cannot be felt, it has probably descended. Next, locates again for the back of the fetus and places the stethoscope over it and listen for the fetal heart tone for 1 full minute. Remember that when you're listening for the FHT, we will use the bell since we're trying to hear a low-pitched sound, which is the fetal heartbeat. A normal fetal heartbeat is around 120 to 160 beats per minute. So during this process, we should also note the location, rate, and the character of the FHT. The cephalic presentation, the FHT can be heard, it's either left or right lower quadrant. And if pitch, the FHT can be heard above the umbilicus, right or left. So mom, I am going to use stethoscope, ha? I will obtain your baby's heartbeat po. Now I'm going to find the fetus back again. So, after this, make the patient comfortable by covering her abdomen. So, mom, now we are done po. So, I'm going to cover your abdomen, ha? So, mom, thank you for cooperation. And lastly, document the observation, which is the fetal findings such as the fetal heart tone, presentation, position, and the attitude to provide database for the future purposes. Again, I am Maple K. M. Mukamad from BSN 2 12D of Group